Syndicosa, and this is how I ally. Welcome to my guest. If you would please introduce yourself and give us a little backstory.
My name is Kristina Leos. I live in Midlothian, Texas. It's a suburb 30 minutes south of Dallas. I have three kids. My oldest just turned 7, my middle just turned 5, and then I have a 1 year old. And my 1 year old is named Victoria, and she's the one I had pretty significant postpartum depression with. And she's the one that's inspired me to share my story and hopefully help other moms. I'm also a NICU nurse in Dallas, and I just have seen it with a lot of moms in my career. I've worked in the NICU for 17 years now, and I've seen a lot of moms suffer silently and go through the whole NICU experience. So I feel that as someone who's gone through postpartum depression, and also I was a NICU mom myself this last time, and I work with NICU moms, I just felt really inclined to share and hopefully help other moms going through some of the same experiences I did.
I think your story is very unique, although probably more common, much more common than we think, that you were a NICU nurse and then your child was in the NICU and you became a NICU mom. Did that just blow your mind at first?
Yes, for sure. My first 2 kids were 37 weeks, no NICU, no visits to the NICU, like, nothing with NICU, and so I just naturally assumed my 3rd child would be the exact same, and she was actually my easiest pregnancy once I was actually pregnant. I worked up until 33 weeks, and then I was actually at work, and I started to feel sick, and everything happened from there. But yes, it gave me entirely new perspective of a NICU mom and what they go through, and I can now say the hardest thing I've ever done in my life is to leave my baby at the hospital and go home without her empty-handed. I've told so many moms, like, "Oh, it's okay, we'll take care of your baby," but I didn't truly understand how awful it is leaving the hospital without her.
I have to divulge that I was a NICU mom.
"Oh, really?"
Yes.
"Oh."
I have twins
Mhm.
and they were in the NICU for 3 months.
Oh my goodness.
Yes. They were they were almost 29 weeks at home.
Yeah. So I'm
So,
sure it's hard for you to hear about it too. You really have no idea until you go through it, and I felt like I was a terrible nurse for the 17 years before that because I never really understood what the moms went through, and I just remember because and my friends were the ones taking care of my kid. I can't imagine, like, leaving them with foreign people that you've never met before. I've known these girls, are my second family, and I still had a hard time leaving her.
did you call a lot? Like, I remember calling every morning and I would call right when I woke up, and I'm sure they were annoyed with me, but that was one of the good things about the NICU.
Yeah, we have cameras on our NICU. I don't know if you guys have the same thing.
No! God, I
So
would have loved that.
yeah, so it's actually there's a pretty big push on getting them. A lot of the NICUs have them, and I really appreciated that. As a nurse, they used to drive me insane because people would call and be like, "Oh, all I can see is her hand." But as a mom, like, it was my saving grace. I would log on and just see, "Okay, she's asleep," or, "Okay, she doesn't have any oxygen now." And so I didn't call as much because I had the camera. And one of the perks of being a NICU nurse is I have almost every single person's phone number, so I would just text them and be like, "Hey, do you have Victoria today?" But I did call, and the doctors at my NICU, they always call every parent every day. I know, which is very unique, I from what I've heard now. So the doctors would call me, and they call everyone, and I just always waited for them to call. So I felt like I was always in the loop.
And this is a big hospital in Dallas,
Uh-huh.
right?
Yes.
That's
Yeah.
incredible.
Yeah. Kids, where do you live?
So I'm in New Jersey. So, They were at the Cooperman Barnabas Medical Center, which is actually really great. They have a fabulous NICU,
Yeah.
but we didn't have Kim. And the doctors didn't call me every day, but I know that they had a lot of different patients. My twins were even towards the end of their stay, they were in the same pod,
Well,
but in different separate
yeah.
thingies.
Yeah.
Same pod,
Yeah.
but they had different doctors. Even they had different
Oh.
doctors. Yeah,
Yeah, we have teams and we have if it's twins, they're always on the same team, the same doctors. Yeah.
crazy.
Yeah.
Makes that makes sense. But yeah.
Yeah. It's interesting how NICU, I feel like it's a newish field compared to most other areas of medicine. Like 30 years ago, a lot of the babies didn't survive, and now we take 22 weeks and above at my NICU. So
Wow.
it's just, I feel like the neonatology world is constantly changing, and even things like cameras and like some hospital I've heard you can like chat with the nurses, and I think some places you can FaceTime with the baby if you're a parent. Like, I guess if they're hospitals that they get a lot of referrals from other states. So it's just it's interesting to watch how neonatology is changing over time.
That's so true. That's so true. I feel like I didn't really know what the NICU was until
Yes.
yeah,
That's
until it
what I
was
always yeah.
everything.
Yeah. That's what I always say, like, when they do the tours, they're like, "Oh, here's antepartum, and here's your labor and delivery room," and they go through everything, and then they'll literally walk past and be like, "This is the NICU," and then it's move on. The NICU is, like, the hardest part of the entire thing if you do have a NICU stay, and I wish that doctors and society in general, like, actually told parents about the NICU and what to expect, and especially if you're pregnant with twins or had a high risk pregnancy or something like that, because I just feel like most parents are blindsided by the entire experience, and you would never expect to see your baby on a ventilator, or it's just so much.
Yes. Yes. It's I definitely wasn't prepared
Yeah.
f for how epic of a journey it was gonna be,
Yeah.
and leaving every day, you just feel this, like, hole inside of you, literally.
Yeah.
You're like, "My babies are not inside me, but they're also not with me. Like,
Yes.
where are they?
Yes.
What's happening?"
Yes, I have a fresh C-section, I have pain, I'm a new mom, but I don't have a baby. It was weird, and I remember I went to my OB appointment, like my 2 weeks postpartum one, and all the moms were in the waiting room with their babies, and I was like, "Here I am a postpartum mom, and I don't even have my own baby." And my doctor was running behind, and I just was like, "I can't sit here any longer. This is just way too much for me to see all these other people with their babies, and here I am for this same appointment, and my child is back at the hospital." So,
Really?
yeah.
So, that must have been torturous for you, that
Yeah.
appointment.
Yeah, so I ended up coming back the next day. The nurse was like, "Oh, yeah, come back another day." She had some emergencies. So I came back the next day, and there was no one in the waiting room, which was much nicer.
Nice. Yeah.
Someone told me, like, the 2nd or 3rd day of when Victoria was in the NICU, and she said, "Christina, once you're a NICU mom, you'll always be a NICU mom, and you'll forever be changed." And it just has resonated with me so much, like, it's just something my brain has changed, and I feel like NICU moms bond, and we just have a connection that you can't explain unless you've been through it.
That's so true. It's true, and moms in particular. Like,
Mhm.
my husband he was working, so I was there much more than he was, but he was still with me throughout the whole thing, but it's different.
Yes, all men grow very different than women, and their emotions are very different. They don't have the postpartum hormones. It is very different for a man and a woman.
Yes. I think the most profound thing that I would feel other than, like, fear that they couldn't breathe or that they wouldn't get off oxygen or something like that. The biggest thing I felt was, like, do they know who I am?
Mm.
Like, do they know that do they have any idea that I'm their mother? And that just, like, even when I say that now, it, like,
Yeah,
it kills me.
yeah, it's so hard. Yeah,
Oh, man.
and I'll hear nurses say, "Oh, my baby's doing this," or, "My baby's doing that," and I guess I never really thought about it until I had Victoria, and I will never say my baby, "Oh, my baby's having a DSAT," or, "My baby's doing this," because it's not my baby, it's the mom's baby, and when I hear people say that in front of the moms, it drives me insane because you just don't realize it, but it's not your baby, it's the patient you're taking care of, it's the parent's baby.
Wow. So have you said that to any of your coworkers or, like, has your relationship changed with your coworkers?
Yeah, and, like, just things that people as nurses that we would get annoyed about, I've told people, like, "Listen, guys, like, you can't get annoyed about this," or, like, the camera thing, like, before I had Victoria, those cameras, like, I knew they were great, but we have parents that call every 10 minutes. Their hand is in the way or their blanket's this and that, and it takes away from the care of the baby because we'll be doing something with another baby, and then we have to answer the phone to say that we need to move the camera to the left or the right. But now that I've seen the cameras and seen what they've done for me, I tell those nurses, like, "Yes, I know the cameras are a pain, but they are the best thing that I have. The closest thing I have to having my baby with me is I can be pumping and log on my phone and see my baby and know that she's okay, and when nothing's happened, I can look and see, does she have a feeding tube? Does she have oxygen? Is she back on the ventilator? Just stuff like that." So, I have been very vocal about the NICU experience and my perspective on staff meetings and stuff, and sometimes I feel like my coworkers are like, "Okay, that's enough. We don't wanna hear about your experience." But I think it's very important for everyone to know, and I work with a great staff and great unit, and everyone they do listen to what I have to say, and the doctors, I've some of them have approached me and been like, "Oh, what do you think about this? And how could we change this?" And I've heard them talk to parents recently about because I blame myself for everything, and I heard them talk and say, "This is not your fault," and just the way they talk to parents, I think is just really great.
Mm, that's wonderful.
Yeah.
So, I definitely want to talk about
Passions like postpartum depression and NICU, so it's
okay, yeah. I think what really struck me, uh, is the in your interview, just I feel like you really painted a picture of depression in itself and just how insidious it is, and also postpartum depression, and then also treatment resistant depression, and how you were working with some very helpful providers, but you also had to do your own sort of research. Tell me more about treatment resistant postpartum depression and that journey. And how vivid is it still in your mind, even if you aren't in the middle of it right now? How close does it feel, if that makes sense?
So my journey with it is another backstory is with my daughter, I had postpartum depression, my oldest, and at 7, and I took Lexapro and just responded well to it. I talked to a therapist like once a month or something, and at the time I thought it was bad postpartum depression, just being a new mom and stuff, but looking back on it, it was not at all. I responded to Lexapro, and so after I had Victoria, I was on magnesium, and I just remember sitting in the hospital bed, and I was like, "What the heck just happened?" Like, I had a baby. It was just this weird feeling, and I could just feel, like, all my hormones crashing, and so I did reach out to my OB-GYN's partner, and I asked her, I said, "I have a history of postpartum depression. After having my son, my doctor just put me on Lexapro just prophylactically to make sure that I wouldn't get it again, and it was great." And then my next kid, I got on the Lexapro after the OB prescribed it, and I would feel like I would get better and then worse and better and worse, and everyone's like, "You have to wait for your hormones to adjust. You have a baby in the NICU. You're all over the place." And I would get better and then worse, and then I thought when she would go home from the NICU, things would be a lot better because I wouldn't be stressed going between Dallas and Midlothian and having 2 kids at home and a baby in the NICU, but that's not how it worked. It actually got worse. And so during all this time, I was seeing my OB-GYN, like, basically every week or every other week about the depression. She is really on top of it, and so she prescribed me something else, and we just kept going up and up on the doses, and finally, I realized this is beyond an OB-GYN's scope. I need to reach out to a psychiatrist, a women's health psychiatrist, so I ended up getting in touch with her. She changed my medications up a little bit, added new stuff. I was on max doses of pretty much everything, and the problem with those traditional SSRIs is it takes 2, 3, 4, 5 weeks to work, and when you're going through it, like, even a whole day seems like so much, and if you're telling me I have to wait for 4 more weeks, like, that's a lot, and I had her in March of 2023, and December of 2023 is when things got really bad, and she told me, "Listen, we don't really have many other options medication-wise, so we can do, like, the shock therapy, the ECT, we can do a partial inpatient hospitalization," which just seemed so much having kids at home. I knew how hard it was being in the hospital with my baby there. I can't imagine being with 3 kids at home. And then I could do some infusions, ketamine infusions, and all that just seemed, like, so overwhelming to me. And I was, like, at that point, like, my baby's 10 months old, and I'm not better. Like, I think not getting better or just thinking that I couldn't get better was the hardest because I didn't think I'd ever get out of it. Because with my daughter, my oldest, I could feel a light at the end of the tunnel, but this, I just felt like there was no way, like, I was gonna live my life forever like this, and I couldn't. I could not. I knew I couldn't do that for myself or my kids for the rest of my life.
Yeah, I feel like in my experience with depression, that that is the worst. That's like the tipping point is when you can't see a light at the end of the tunnel.
Yes. Yeah.
That is when it's, "Okay, this is dangerous. This is" it's that hopeless feeling.
Yeah. Yes. Yeah, and just, like, telling myself I'm so bad at all this stuff and, like, I thought I was a bad employee, a bad mom, a bad wife. It's just so weird because looking back on it, I'm like, "Wha how could that happen? Like, how could I feel like that?" But it's just you don't really understand it. It's like the NICU thing. You don't understand it until you've been through it, and that dark tunnel you get in is so hard.
Yeah.
So, I had a psychiatrist who was in her residency. So the hospital that I was being seen through the psychiatry clinic has a residency program, and so they're psychiatrists, but they talk to you, like, for part of their classes or whatever. So I saw her for a while, and she was really great. At first, I was not a huge fan of her because she was very, like, pushy, and "You need to do this, you need to do that," and I was like, "I can't." But I have a great respect for her, and I think she's wonderful. And so she really pushed me to do more and to ask for more, and my OB-GYN as well, she was always willing to help me, which I've heard from a lot of people in the postpartum support groups that a lot of OB-GYNs will blow people off and be like, "Yeah, it's just hormones," but luckily, I know my OB-GYN very well. She's known me for a long time, and she was very supportive, and she'd have her nurse call and check on me and stuff, and I never felt like if I told her something, she would think badly of me or anything. So I did with all the extra help was very helpful, but I had actually heard about this new prescription drug that had come out, the pill form that was the first FDA approved medication for postpartum depression, and I researched it a little bit. I think honestly it showed up on my Facebook feed, like, back in September when it was approved, and I was just like, "I'll like it, whatever," but I didn't really think too much about it. But when I was here at this point where they're like, "You can get shock therapy or ketamine," or I was like, "I'm gonna ask my psychiatrist about it," and so I did, and she said she didn't really know much about it. And so she had to reach out to, like, the drug rep or the drug company or something, and so she did, and she called me back a few days later, and she said, "I think you'd be a really good candidate for this. I'm not sure how to prescribe it yet." Like, y she didn't tell me straight up, but I knew that I was her first patient to take it, and probably the first at the clinic because of the lack of knowledge about it, which is fine. It just came on the market. Just getting it, and I was really scared about taking it because it was a new medication. I didn't know anyone who had taken it before. Most of the things I know someone that has had something, but not this, and it's the first time I actually read, like, the entire pamphlet of the side effects and all that kinda stuff, and I read it and it was scary, and I actually was like, "I don't know if I should do this," but I knew that there was no other way out, and I was willing to try it, and I think all those pamphlets are always scary if you actually read them, but the side effects were nothing compared to even the other medications like the SSRIs. Those don't make you feel that great either. It was great. I started it January 1st of 2024. I think I got it, like, the day after Christmas, but I was like, "I'm gonna start it at the end of the year to make 2024 a new year for me," because 2023 is such a blur and such a horrible year. So I started it January 1st, and it took you take it for 2 weeks, and I made sure I wasn't working the first 5 days just because I read, like, it can cause sedation and you can't drive and things like that, and those effects were very minimal. I just took it at night, and I'm glad it made me sleep. Part of depression is getting better is sleeping, and I was a little bit dizzy, but again, like, the effects were so minimal compared to how much it helped, and by the 2nd or 3rd day I had heard that cliche about the fog lifting, and I was like, "Whatever, I don't" but it did, like, I was driving and I was like, "Oh my god, this is the fog that people were talking about." Like, I could literally feel it lifting, and each day I just felt better and better, and it was just such a it, like, changed my outlook on things because, like I said before, I just thought I was going down a dark hole and I'd never get out of it, and it was the first time since March that I could feel the cloud lifting and feel, like, happiness again that I hadn't felt. I never had that joy of having my daughter, who, by the way, was an IVF baby, like, we wanted her so bad. I went through so many shots and painful procedures and stuff for this child, and I could finally hold her, just feel the love that I never felt before I took that medication. So I feel like it's a such a lifesaver for me and so many other women out there, and again, I'm in these postpartum support groups on Facebook and stuff, and I'm just so surprised by the lack of knowledge that people have of this, like, the doctors even. The doctors will be like, "Oh, I'm not a candidate," or, "I need to do this and this," and I'm like, "What? I don't know where you guys are getting this stuff from." So, I try to tell people, like, there's other things besides SSRIs as well out there.
Yeah, that's huge. That's very important. I
Yeah.
feel like Zoloft is like the and
Mhm.
I'm not talking badly about Zoloft, but I feel like that is the one that they're like, "Postpartum mother, Zoloft."
Yeah, yes, and I took that too. That was one of mine that I took this last time with her.
Yeah.
And, like, the side effects of that, I never felt great on it either. And then getting off of it, like, weaning off those SSRIs, like, the brain zaps and just I always felt so gross getting off of them, and I didn't feel like that with the Zuranolone.
That's
Just
incredible.
yeah, and it's just 2 weeks, like, it was and that was another thing I was worried about was, like, pumping, and as a NICU mom, like, one of the only things you can provide is milk, and I was like, "Man, like, I can't give my baby my milk when I'm on Zuranolone," but I just pumped a whole bunch before, and I saved it up and froze it, and so for those 2 weeks, I gave her frozen milk, and she was totally fine, and then I just pumped and saved it for milk baths and stuff like that, and then once I was done with the medication, I pumped a few more days and threw it out and then got back to feeding her the milk, and it's just 2 weeks, and it's you could do anything for 2 weeks, even formula. Like, I did give her some formula too, and that's another thing of mine is people that don't produce enough milk, formula does not kill babies. It's the best thing besides breast milk. All my kids have had formula, and they're all survived,
Yes.
and
Yeah.
yeah, I mean, honestly, I think it's nice to not have to, like, be so OCD about milk and stuff while I was on the, Zuranolone because I didn't feel bad giving her formula because I knew I was doing what was best for myself.
Yes, and for you, the most important thing for Victoria was for you to be okay.
Yeah, yeah,
'Cause, uh, there's something like the number one predictor for a child's well-being is the well-being of the child's mother. Or I don't know, I've always heard that, and so I keep saying it just because I really believe it.
yeah.
Yeah,
And
yeah.
if you look at studies, it's I think kids with parents who have had depression or anxiety, like, they have, like, low language and low delayed this and delayed that, and that's what I was reading, and I was like, right now, I think it's the end of the world if she doesn't get breast milk or whatever, but it's gonna affect her so much better, and I could see how it affected my older kids too. My oldest daughter is very sweet, and her teachers would be like, "She's not acting good, and she's getting in trouble," and it's just that was not my oldest child, and I needed to change something.
Wow, that's so interesting. That's so interesting. You know, because my twins are my only
Mm.
children
Yeah,
and will be my only children a as far as I can tell. So I don't know what I have not had that experience of how things affect the older children. That is like a
I
whole other huge dimension.
yes, yeah. Both my kids were very affected, and I just was so shocked that they say healthy mom is healthy baby, and that's so true, and healthy kids as well.
Yeah. I think it's incredible that you found your own like you found your own like you saved yourself, really. You found the drug.
Yeah.
Uh,
Well,
I think that's pretty incredible.
yeah. I'm a huge researcher. I
Yep.
love to research whatever it's about, and I think I read kind of a side note that I think, 1 in 3 NICU moms have postpartum depression. The statistics are so high, and that's of the people that are reporting it. So that's why I love to share my story with people. I'm actually a super private person. I don't think many people at all knew anything that was going on when I was going on because I was so embarrassed and ashamed. But I'm so shocked by the number of people that don't know much about this medication or postpartum depression. And so that's why I'm willing to share. And there's no off questions or off limits of anything because I think we just need to be open more about it as a society and as moms. And I think especially with social media, you scroll through social media and everyone's kids are like dressed perfectly and their houses are perfect. And here I am like, oh my God, I'm lucky if I take a shower every 4 days. And
Yeah.
why? And my kids look terrible and my house looks terrible. And there's laundry piled up in there. And I just think we just need to be more open as moms about what it's really
Absolutely. I couldn't agree more. That's why I'm so passionate about doing these interviews. I think women face obstacles when telling their stories anyway, when trying to be heard. There's already something to fight against as a woman.
like.
And so we just we need to hear from each other. We need to be here for each other. And the fact that you are a NICU nurse, you have every respect and credential, and it's not like hearing about postpartum depression from just anyone, if that makes sense.
Yeah, and just I was super blessed. I had a ton of resources. Like I could text someone and be like, "Can you connect me to a psychologist or this or that?" And so many women don't have those resources, and psychological care is expensive. I don't know many insurances at all that cover psychologists or counseling. My husband works for the federal government, so we have one of the better insurances, and I think they cover 6 appointments, which 6 is nothing for mental health, and I know I'm super lucky that I got the 6. And, like, my psychologist I was seeing at first, I think it was, like, $210, for 45 minutes, which is pretty much the going rate. I feel like she was not overly priced, but you can't afford that, especially when I had to go for a while, I was doing it twice a week. Things were that
Wow,
bad.
yeah.
And so I was like, "I'm on maternity leave, I'm getting, like, half of a paycheck, I'm spending tons of money on this psychology." So I was super lucky that my psychologist did refer me to the resident clinic where it was only $20 for each appointment, which was a huge lifesaver. I still spent thousands of dollars on therapy, but it was only $20 each time. So I just feel like the access to maternal mental health care is so bad. Um,
So bad.
so bad, and it's expensive, and most people can't afford that. My husband and I both work, and we both have decent jobs, and I could definitely not afford $200 for counseling so often.
And not to mention you have a new child and
Mhm.
other children.
Yeah.
It's hard to justify spending so much money on yourself, even though it is incredibly important when you have children. Yeah, I have found that for sure.
Yes. And then, like, hearing the cost of that medication too, I think when I read it, they said it was like $1,800 or 1,700 or something, and I was like, "Oh my god." That on top of the hundreds of dollars I'm spending on therapy, but Sage has a savings card or something, and it ends up being, like, so much cheaper. I ended up paying $0 for that medication, which was cheaper than my copay for the, Lexapro or the Zoloft or the Wellbutrin. I took all 3 of them. I just again, I think that people should know that because when you see 1,500 or thousands of dollars for medication and don't know that there's options out there for savings, that was so much cheaper for me than
Yeah,
the I think I paid $30 copay for the other one, so
that is huge. That is really important for people to know. It really has not been that long. My twins were born in April of 2023.
oh, well, yeah,
Yeah,
or like a month. I was due April 15th with her, so, uh,
really.
yeah, I had her March 8th. So, yeah, they're around the same age.
Yeah. So how is she doing?
She's doing good now. She's 21, no, maybe 20, yeah, 20 months now. Just the sweetest baby. She's got her own little personality, and she lets us know how she feels about stuff, but she's been my easiest child overall. She goes with the flow, and I maybe as a 3rd child, you have to. Because like, with my first, I was like, "Oh, I have to do this nap time at this time and this at this time," and with this one, I'm like, "Oh, yeah, I forgot she didn't have a nap today." So, she has a good personality, and she does have a little speech delay, which part of me wonders if it had anything to do with the postpartum depression. I'm not sure, but she goes to therapy, and she's getting better, so if that's all that came out of she's getting better with it, and I'm very thankful if that's the least or the most that has happened to her from it because of how long it lasted for me. And
Yeah.
it's so hard to look back at pictures of her first year of life, and I don't remember any of it. And that's one of the biggest things that I usually cry thinking about is, like, I missed out on her whole first year of her life, and I felt so much guilt about it, and I wish I would have, taken the medication or gotten better help sooner because you can never get that first year of life back. And they grow so fast, and I missed all the baby stage, and it's something that we wanted so bad.
Yeah. But I'm not but because I completely validate how you feel. It's also not your fault that this bell jar. I always think of your interview made me think of The Bell Jar by Sylvia Plath,
Mhm.
just descending and everything is distorted and then it lifts back up. And it just was not, you didn't ask for it. You
Yeah.
didn't you didn't say, let's do that.
Yeah. Yeah, I just remember, like, messaging my OB-GYN because her mom had surgery, like, the day I delivered my baby, and so I messaged her, and I was just telling her, like, "I'm not feeling right," and she's, "We're gonna be proactive about this. We're not gonna go through the same thing. Let's up the dose," and I was so confident about it, and you're talking about I didn't ask for that. I was thinking, like, "We are gonna be so good. I'm not gonna go through anything," and then despite everyone's best efforts, it happened, and it was so bad.
Yeah. It was so bad and it was nobody's fault.
Mhm.
And
Yeah.
that's hard. That's hard. That's hard to that could be hard and comforting because there's no one to blame. And sometimes it's nice to blame someone.
Yeah, that's what it's a true chemical imbalance, like, it's nothing that you can do. It happens to people that are poor, rich, have the best support system in the world, have no support. I don't know. I know there's risk factors, but doesn't discriminate.
Especially with postpartum depression, I think. Yeah. So I just think you're incredibly brave to have come out the other side and to have done all of that work and to now be telling your story for the benefit of other women. And that's just, in my mind, that's the best thing that you can do.
Yeah. Yeah, definitely, and just even at my job, I've been advocating for mental health, and I think we had a psychologist before, but no one knew about it or something. But now, like, the psychologist is very involved in our unit, and the doctors know about it, and the nurses, and I'm very thankful that people are willing to listen and make steps for these parents, especially NICU parents, because the risk is just so high, and it's an experience you can't describe unless you've been through it.
Yes, absolutely. Thank you so much for joining me on this episode, and maybe we'll talk again at some point.
Yeah, anytime. I'm always willing to talk, and especially as the months go by and just watching everything change.
Yeah. All right. Well, thank you.
Yeah, thank you. It was good meeting you in person.
I know. I know. It's great.